Borna Disease Virus, BDV, was first discovered in the late 19th century. The disease itself, known as Borna disease, was identified in 1885 in Germany when it caused an outbreak of fatal encephalitis among horses in the town of Borna, Saxony, after which the virus was named. However, the virus was not isolated until much later, in the 1920s, when researchers began to study the disease more intensively. It was finally identified as a unique virus and classified as part of the family Bornaviridae. Borna Disease Virus, BDV, primarily infects the central nervous system and is transmitted through various routes. The most common route of infection is thought to be through the inhalation of contaminated secretions or excretions, such as saliva, nasal secretions, or urine from infected animals. This oro-nasal transmission is especially significant in animals like horses and sheep, which are the primary natural hosts of the virus. Direct contact with infected animals or their secretions can also lead to transmission, particularly if there is contact with mucous membranes or abraded skin. Although less common, there is evidence that BDV can be transmitted vertically from mother to offspring. In research settings, BDV transmission can occur through direct exposure to the virus, such as through needlestick injuries or handling infected tissues. Once the virus enters the host, it typically travels to the brain via the olfactory or peripheral nerves, where it can cause encephalitis and other neurological symptoms. Borna Disease Virus, BDV, infection primarily targets the central nervous system and manifests through a variety of neurological symptoms, which can differ depending on the species affected. In horses and sheep, BDV typically causes significant behavioral changes. Affected animals may show signs of depression, anxiety, or agitation, becoming unusually timid, aggressive, or hyperexcitable. As the disease progresses, these animals often experience ataxia, characterized by a lack of coordination, leading to stumbling, difficulty walking, and uncoordinated movements. Some animals may press their heads against objects or repeatedly walk in circles, behaviors that indicate severe neurological distress. In advanced stages, paralysis may occur, starting with the hind limbs and potentially leading to an inability to stand. Seizures are another severe symptom, which can sometimes be fatal. Additionally, nystagmus, or involuntary rapid eye movement, may be observed in some cases. In laboratory animals, such as rats, BDV infection can result in pronounced behavioral abnormalities. Infected animals might display hyperactivity, increased aggression, or stereotyped behaviors, which are repetitive and unvarying actions. Cognitive impairments, including learning and memory deficits, are also common, with affected animals showing difficulty in learning tasks or retaining memory. Motor dysfunction, similar to that seen in larger animals, can occur, presenting as ataxia, tremors, or other coordination issues. Weight loss is frequently observed, potentially due to reduced feeding behavior linked to the neurological impairments caused by the virus. In humans, BDV infection is rare and somewhat controversial. Some studies have suggested a potential link between BDV and certain neuropsychiatric disorders, where symptoms might include depression, mood swings, or other psychiatric symptoms. However, this connection remains debated and is not fully established. Overall, BDV primarily induces neurological and behavioral symptoms, with the severity and specific manifestations varying depending on the host species. In animals like horses and sheep, the disease can be particularly severe and often fatal due to the progressive neurological damage it causes. There is currently no specific antiviral treatment or cure for Borna disease virus, BDV, infection. Management of the disease primarily focuses on providing supportive care and, in some cases, utilizing experimental treatments to alleviate symptoms. For animals infected with BDV, supportive care is the cornerstone of treatment. This involves ensuring the animal is kept in a comfortable environment, maintaining adequate hydration and nutrition, and addressing any symptoms that arise. In cases where neurological symptoms are severe, additional support may be necessary, such as assisting with mobility and feeding. Corticosteroids are sometimes used in an attempt to reduce inflammation in the central nervous system, a major effect of BDV infection. However, this treatment is generally palliative, aimed at easing symptoms rather than offering a cure. Additionally, if an infected animal experiences seizures, anticonvulsant medications may be administered to help control these episodes. Like corticosteroids, anticonvulsants treat the symptoms but do not address the underlying viral infection. Research into treatments for BDV is ongoing, especially regarding the virus's potential impact on human health. While experimental therapies, including antiviral drugs, have been explored in laboratory settings, no widely accepted or proven treatment for BDV currently exists. Given the lack of effective treatment options, prevention and control measures are critical. Isolating infected animals is essential to prevent the spread of the virus, particularly in agricultural settings where horses and sheep are at risk. Good hygiene practices and minimizing contact with infected animals are also key strategies in reducing transmission. In summary, while supportive care and symptomatic treatments can help manage BDV, there is no specific treatment or cure available. Prevention through stringent control measures remains the most effective approach to managing the risk of BDV infection.